Hello, my name is Hannah Moore, and today I will be presenting on neurofeedback, which is an innovative addiction treatment intervention. Neurofeedback is a specific branch of biofeedback that optimizes the human brain's ability to restore itself and resume normal functioning using real-time electroencephalography and audiovisual stimulation to train the brain. While multiple methods continue to be developed, the original neurofeedback was utilized for epilepsy patients in the 60s. Neurofeedback has not been well known because research was originally inconclusive, and pharmaceutical companies have been hesitant to release the information due to remarkable results received without medication. It's important to understand the effects of addiction on the neural mechanisms and function of the brain to then understand how neurofeedback targets these areas. Addiction changes the dopaminergic pathways in the brain, leading to tolerance, withdrawal symptoms, and cravings. It also alters our brain's ability to shift between being alert and focused to being relaxed. This is why the associations made when addicted leads to having a disease of the mind. Neurofeedback is simple to do, making it a good treatment option for many patients, including those with comorbid mental health disorders, and adolescents are often engaged by the technological component. It works by using 1 to 19 electrodes in most protocols, and in the case of addiction, it tracks the patterns and hertz levels for alpha, theta, and sometimes beta brainwaves. When the waves are in normal levels, the video or pitch plays normally back to the patient and rewards the participant's brain. But when the waves are outside of these levels, the video or pitch will stop and start, go dim, etc., prompting the patient to focus and relax, bringing the waves into normal levels. So over time, this trains the brain to remain within optimal desired states. For the addicted brain, this results in fewer cravings and the ability to have control over one's thoughts and choices. Neurofeedback has been studied for several decades and continues to show positive and efficacious results for multiple populations. The results of these studies give much hope and optimism for those struggling with addiction. When combined with several other traditional addiction treatment methods, such as AA, Narcotics Anonymous, different 12-step programs, even medication. When combined with these and traditional addiction treatment methods, those individuals have double to triple the chance of having a positive outcome compared to those that do not train with neurofeedback. Also, the top predictor of relapse into drug and alcohol usage is continued high beta levels, which are kept in check with brain training. And finally, neurofeedback enhanced therapy demonstrated an 80% sobriety rate after 4 years versus the 20% rate for those that had only traditional psychological and pharmacological therapies. So as research progresses, experts in the field are optimistic about how these methods can be used by addiction treatment centers, clinical therapists, doctors, and even through at-home clinics to improve the life and well-being of those living with addiction. Thanks for listening, and I encourage you to research more. Here are my references.